You've definitely heard of gout and rheumatoid arthritis, right? They're both famous for one thing, absolutely agonizing joint pain. But honestly, that's pretty much where the similarities end. See, one is basically a chemical problem, while the other, well, it's like an all-out civil war happening inside your own body. And believe me, understanding that difference is the key to everything.
So let's play a little game. Can you guess which is which? One is really just a simple chemical imbalance, kind of like a recipe that's gone a little bit wrong. But the other? That's a full-blown civil war, where your body's own defense system gets confused and starts attacking its own side.
Okay, drumroll please. The answer is, gout is the chemical problem. It's caused by these tiny, sharp crystals of something called uric acid building up in your joints. Ouch. Rheumatoid arthritis, that's our case of mistaken identity. It's an autoimmune attack where your immune system literally gets confused and starts targeting your own joint linings. So, the big takeaway here? One is a chemistry problem, the other is a massive communication breakdown in your immune system.
All right, so to really get our heads around this, here's the plan. First, we'll frame these as two totally different battles. Then, we'll dive into the whole uric acid story with gout. After that, we'll get into the body's civil war with RA. We'll check out the arsenal of drugs doctors use, and then we'll wrap up by looking at what's next.
Okay, let's jump right into Section 1, arthritis. Two different battles. And you might be asking, why does this even matter so much? Well, it's because the strategy you use to fight a chemical spill is completely, totally different from the strategy you'd use to stop your own army from attacking itself.
All right, let's kick things off with the chemical problem. That brings us to Section 2, fighting gout. Here, we're going to see how doctors handle what is, at the end of the day, a chemical imbalance that can be managed.
So what exactly is gout? Well, the textbook definition is a type of arthritis caused by one single thing: too much uric acid floating around in your blood. When the levels get way too high, it just can't stay dissolved anymore. So what does it do? It forms these nasty, sharp, needle-like crystals that decide to set up camp in your joints. And yeah, that causes some pretty excruciating pain.
Because of how it works, the treatment for gout is really a two-step dance. Step 1 is when you're in the middle of a painful flare-up, an acute attack. The goal is simple: put out the fire, fast. Doctors will hit it with powerful anti-inflammatories, like NSAIDs, steroids, or a special drug called colchicine. But once that fire is out, the real work begins. That's Step 2, chronic management. And the goal here is to get those uric acid levels down for good, so you never have to go through that again.
So how in the world do you get that long-term control? Well, it all boils down to managing this one very specific metabolic pathway you see here. The best way to think about it is like a little factory inside your body that's constantly producing uric acid. If you can control the factory's output, you can control the gout.
And doctors have 3 main strategies for controlling that factory. It's actually pretty clever. Strategy 1, block production, just slow down the assembly line. Strategy 2, increase excretion. Basically, open up more shipping docks to get the uric acid out of the body faster. And strategy 3, increase metabolism. This is like hiring a special crew to convert the uric acid into something else entirely, something that's way easier to get rid of.
And here's how those strategies look in the real world with actual drugs. For blocking production, you've got a drug like allopurinol. It basically throws a wrench in the factory machinery by blocking a key enzyme. To increase excretion, a drug called probenecid tells the kidneys, hey, open the floodgates and flush more of this stuff out. And for that special crew that increases metabolism, a powerful drug like raspberry case literally converts uric acid into a totally different substance that just dissolves in water. See? 3 different tactics, but they all have the exact same goal: get that uric acid level down.
Okay, now I need you to put all that chemistry stuff on a shelf, because we are switching gears completely. Welcome to Section 3, RA, the body's civil war. We're not in the world of chemical imbalances anymore. Here, the problem isn't some substance that's building up. The problem is the system itself. This is about the body's own immune system launching a friendly fire attack directly on the joints.
And that fundamental difference, it changes the treatment goals entirely. Now sure, just like with gout, doctors can use things like NSAIDs and steroids to get a handle on the immediate pain and swelling. They work fast, and they definitely make you feel better in the short term. But, and this is a huge but, they do absolutely nothing to stop the disease from progressing. To actually stop the attack itself, you need a totally different class of drugs, called DMARDs. They're much slower to act, but their whole purpose is to slow down the actual progression of the disease.
And that really gets to the heart of it. The whole philosophy behind using these DMARDs, that's a mouthful, it stands for Disease-Modifying Anti-Rheumatic Drugs, is that it's all about playing the long game. It's not just about feeling better today. It's about protecting your joints for tomorrow and preventing the kind of irreversible damage this autoimmune civil war can cause over years and years.
And that brings us right to the cutting edge of RA treatment. Section 4, the DMARD arsenal, old and new. The story of these drugs is honestly incredible. It shows how medicine has moved from these, well, kind of like broad carpet-bombing approaches to incredibly specific, almost like laser-guided precision strikes.
So this arsenal is basically split into two big categories. On one side, you have the conventional DMARDs. Think of these as the old guard, the tried-and-true drugs that have been around forever and work in a more general, broad way. And then, on the other side, you've got the biological DMARDs. These are the newer kids on the block, created with fancy recombinant DNA tech, and they are designed to hit one very specific target in the immune system's attack plan.
Now, when you talk about those conventional DMARDs, there's one drug that's the absolute king, the main workhorse, Methotrexate. For a long time, this has been the first drug doctors reach for when treating RA. Why? Because it has really powerful anti-inflammatory properties that just help calm down that entire overactive immune system.
But then you have the biological DMARDs. And these are less like a workhorse and way more like a team of special forces. Seriously, each one is engineered with a very specific mission: to find and block one of the key communication signals that immune cells are using to coordinate their attack on your joints.
And this is what that precision strike actually looks like at a molecular level. It's so cool. This biological drug, avatacept, for example, it physically gets in the way of two immune cells that are trying to talk to each other to plan an attack. It just blocks the signal. The key thing here is it doesn't kill the cells or anything. It just stops the dangerous conversation that leads to all the damage.
And blocking that handshake is just one type of mission. The arsenal of targets they can go after now is just incredible. Scientists have developed drugs that can block all sorts of different inflammatory messengers. These little proteins with names like TNF-α or IL-6. And like we just saw, others can block the cells from even communicating in the first place. It gives doctors this amazing toolkit of precision weapons to choose from.
Okay, so where does all this leave us? That brings us to our final section. What's next for arthritis? Let's tie all these different threads together and really look at the big picture. And here it is, the main takeaway from this whole thing, laid out perfectly. It all comes back to this fundamental, core strategic difference. When you're treating gout, you're dealing with a metabolic problem. The goal is just to manage the numbers, get those uric acid levels back where they belong. But when you're treating RA, you're dealing with an autoimmune problem. The goal is way more complex. You have to try and recalibrate an entire intelligent system that started making very bad mistakes.
Which really leaves us with one final fascinating question. We've seen these treatments evolve from, broad-acting drugs to these hyper-specific agents that can target a single molecule. So as our understanding of the immune system gets deeper and deeper, is the future of treating arthritis not just about picking the right drug from a list, but about designing a totally unique, personalized battle plan for every single patient? It's something to think about. Thanks for joining me for this explainer.